Hi, Dr. McCann here. Are you tired of dealing with menopause symptoms and have been wondering if Ozempic can be the treatment option you've been looking for? In this video, we're going to dive into the world of Ozempic and explore its effectiveness in helping alleviate some of the symptoms of menopause. From hot flashes to night sweats, we'll cover all of it. Whether you're considering Ozempic as a treatment option or just want to learn more about the medicine, this video is for you. So let's get started and find out if Ozempic really does help with menopausal symptoms. Ozempic works by mimicking a hormone in your body called glucagon-like peptide 1 or GLP-1, and this hormone regulates blood sugars, but it also has a secondary effect on reducing body weight and improving insulin sensitivity. But what does this have to do with menopausal symptoms? Well, some studies have shown that Ozempic can help reduce hot flashes and night sweats and have a positive effect on these symptoms, which are two of the most common symptoms, debilitating symptoms of menopause. There are studies that are looking to see if these drugs act directly in the brain at with the vasomotor symptoms to help decrease the vasomotor symptoms of hot flashes and night sweats. So let's go over the known benefits that will help with menopause. Number one, as I mentioned, it may have a direct stimulatory effect on the area in the brain that is responsible for the hot flashes and the night sweats, but studies are ongoing on that. Number two, we know it decreases body fat. So obese people, when they're going through perimenopause and menopause, do have increased hot flashes over people that are not obese. So getting some of that weight off can naturally help with some of those vasomotor symptoms. And number three, let's not forget about the most important is weight loss. So one of the most common complaints I hear in my office and perimenopausal and menopausal women is that they're gaining weight around the midsection and they can't get it off. And it's not just in your head, this is definitely true. So we know that Ozempic and Mounjaro both significantly help weight loss. And so as you lose those fat cells, it can help with the symptoms of the vasomotor symptoms, the hot flashes and night sweats. And another added benefit with the weight loss, as it can decrease the vasomotor symptoms, it can decrease cancers that are estrogen sensitive. So fat cells do make estrogen. It's a different kind of estrogen. It's a bad estrogen. And there are certain cancers, including breast and endometrial cancer, that are increased in susceptible individuals when they are overweight or obese. So getting rid of this extra fat can help decrease the chance of getting endometrial and breast cancer. So while there are multiple benefits of taking these medications, Ozempic and Mounjaro, there can be a downfall. So if you lose too much weight, you may be at an increased risk of osteoporosis. So it's very important to follow up with your provider so they can monitor your progress. While you're losing this weight on this medicine, it is important to keep your metabolism. And you're going to do that by one of two ways. Number one, you're going to exercise, and that will also help protect the bones. Number two, you're going to make sure you get in enough protein. The whole goal of this is to keep your muscle by exercise and getting in enough protein so that when you get off of the shots, you're going to be able to keep the weight off. As far as protein goes, it does need to be a high quality protein. I recommend the Cornerstone Meal Replacement Protein. It's a high quality whey protein. I've been using it in my office for more than 10 years. It has all of your daily vitamins and minerals, which can be very hard to get while you're on Ozempic or Mounjaro. Also, when you blend it with milk, it has that extra calcium, so it also helps protect against bones. So in conclusion, menopausal symptoms can affect every aspect of a woman's life, and the GLP medicines like Ozempic and Mounjaro do have some positive benefits, but studies are ongoing.